Hello, welcome to another episode of Sisters in Scrubs. I'm Dr. Rebecca, a family doctor.
And I'm Dr. Vanessa, a pharmacist.
And today we're talking about a question we get often at the clinic. Is it true that if you sweat more during your workouts is more effective? So we have a lot of patients that do a lot of cardio and that don't see results in their body composition. So today's topic is HIIT versus strength training, what actually works. So Vanessa, if I were to ask you, what is the definition of a HIIT workout? What is a HIIT? What would you do for a HIIT workout?
So HIIT is essentially an abbreviation for high intensity interval training. So essentially what that means is that you go short bursts of high intensity work followed by a short period of recovery, and you repeat that cycle a couple of times. So when we're talking about HIIT, think of sprints, it could be an assault bike, it could be burpees. We really want you to get to that high intensity interval zone and then follow that up with a really short period of recovery.
So what is a high intensity zone? Like, how could a patient know if they're going hard enough in an interval, for example?
So essentially, a high intensity interval zone, so a HIIT zone, means that we want to be hitting about 80 to 90% of your maximum heart rate. Just a quick way to kind of estimate your maximum heart rate is subtracting your age from 220. So 220 minus your age. If you're someone that is, for example, 30 years old, 220 minus your age means that your maximum heart rate is at about 190 beats per minute. So you want to be at about 80 to 95% of your maximum heart rate, which would bring you up to anywhere between 150 to 180 beats per minute. So that's your HIIT zone. So you want to be hitting that HIIT zone. You want the effort to be really consistent. So you can't really sustain a conversation at this effort. It has to be at about an 8 to 9 out of 10.
And how long do you have to stay at this zone?
So you want to essentially be at this zone for less than 60 seconds. But because if you're going above 60 seconds, studies do show that you're not able to maintain that 80 to 95% maximum heart rate, so that HIIT zone. So you wanted it to be 60 seconds or less, followed by a short period of recovery.
So what is the recovery heart rate? Like, what do you have to aim? Do people have to stop doing the exercise, or can they still do movement during this period of rest, like rest or reducing their heart rate, for example?
So during the recovery period, you want your heart rate to be at about 50 to 70% of your maximum heart rate. So it's not necessarily to stop completely. I mean, if you're stopping and if you're able to sustain that heart rate, then it's fine. Or what you could do, for example, if you're doing sprints on the treadmill, you can go all out for, let's say, about 60 seconds and then follow that up with a 60 seconds of light jogging and then kind of repeat that a couple of times.
Yeah. So let's talk about the benefits of HIIT. Okay, so we have an interesting study here that shows that a HIIT workout can actually reduce our fat percentage. It can increase our cardiovascular health. And another study showed that over 3 to 16 weeks of including HIIT workouts, we can reduce our body fat percentage by 1.3 to 1.5%, and our body fat mass from 1.4 to 1.9 kilograms.
So how many sessions should we be, like, how many sessions was the study mentioning per week to get to those amounts?
Yeah, so basically, one meta-analysis, I think that was done in 2023, showed that you need a program that is at least 8 weeks and that has at least 3 sessions per week and a work interval, like we had mentioned before, of less than 60 seconds. So what does a work interval of less than 60 seconds mean, so patients can understand?
We want to essentially increase your heart rate, right? So it could be sprints on the treadmill, it could be sprints on the assault bike, sprints on the elliptical. It could even be swimming sprints, doing laps. It could be burpees. So essentially whatever you can do to get you to that 80 to 95% of your maximum heart rate.
Yeah. And another thing we mentioned is that it can also improve our VO2 max. So what is the definition of a VO2 max? And I think it's very important for everybody to understand that.
What is VO2 max? So VO2 max is essentially the maximum amount of oxygen that your body can use during exercise. So It estimates how much oxygen your body can take from your lungs, deliver it, and use it in your muscles throughout an exercise session.
So the higher your VO2 max, the better your cardiovascular fitness is, the longer you can sustain efforts, and it also reduces your cardiovascular disease risk. It is the strongest predictor of longevity.
So when we're talking about HIIT exercise, how long should people aim to do, let's say, a HIIT exercise session for it to be considered beneficial or for them to actually produce results?
So we have another interesting study that showed that when we do less than 15 minutes of a HIIT workout during a session, it produces similar or greater improvements in your cardiorespiratory fitness and even glucose control compared to a moderate intensity continuous training. For example, aerobic training, people who go to Zumba or any other sustained cardiovascular exercise, which is very interesting. So it is very time efficient as well.
So what I'm understanding is that people who do 1 hour of sustained cardio, like sustained running, maybe zone 2, zone 3 cardio, Zumba, dancing, whatever it is, compared to someone who's doing a 15 minute or less HIIT session, the benefits seem to be pretty much similar in terms of weight loss or body composition, right?
Exactly. It's a very time efficient way. We make sure that you're working as much and it takes 50% less time to get the same results, which is amazing. So now let's talk about strength training. So what does strength training mean when we talk about or when we suggest strength training to our patients? How do we explain that to our patients?
Strength training essentially is all about resistance, right? So you're lifting weights, you're using machines to lift weights, or you're even using body weight. So it is a form of exercise. The goal in itself is to either preserve or increase muscle mass because we know that with time we do lose muscle mass. Interestingly enough, strength training is the only form of exercise that combined with a calorie restriction, so by eating less, you're still able to increase muscle mass, which is not applicable to other forms of exercise. So strength training has its place as well when we're talking about weight loss and body composition. What are some studies about strength training and their benefits?
Yeah, so we do have other very interesting studies about that. So studies show that it can increase your lean mass by around 0.8 kilograms. It can reduce your body fat percentage by 1.5 to 1.6%, and reduce your fat mass by 0.5 kilograms, which is very interesting. It also reduces our visceral fat. It also increases our metabolism. It is our driver for our metabolism. So when we talk about how to increase metabolism, how to make our metabolism faster, meaning how do we burn more calories at rest, the only way to do that is by increasing your muscle mass. And a lot of the times our patients have a hard time believing us. They only start believing us when it actually happens and they see the results on the body composition scale when they do see their muscle mass increasing and they do see their number of basal metabolic rate increasing, which is super interesting and exciting for them.
So that's one of the reasons why actually a lot of patients that come to us and we do the in-body composition scale because really it's the only way for us to kind of figure out what's going on behind the weight. When patients see, let's say, that the weight has pretty much maintained the same, but in the meantime, muscle mass has increased, body fat has decreased, metabolism has increased. Those are changes that you see in your body that the scale is not necessarily just a regular scale, is not necessarily able to explain to you. So a lot of times I have patients that come to me, we put them on the scale, they see their weight, they're kind of surprised because they have seen and felt the physical changes. Clothes start to feel different, they start to feel different, but the weight in itself hasn't really changed much or has slightly decreased. But on the back hand, we see that, fat mass has decreased, lean mass has increased. So those are all changes that you're going to see when you actually start strength training.
So when we're talking about suggesting an exercise program for our patients, do we suggest HIIT? Do we suggest strength training? Do we suggest both? A lot of studies, especially in postmenopausal women, show that combining both is the best option. So let's go back to some studies that we've seen with postmenopausal women. So HIIT is more effective than moderate intensity continuous training. So take, for example, a typical patient that we see that tells us that she's active 4 to 5 times a week, that goes to XYZ class, for example, either Zumba, an aerobic class, and that does 45 minutes of this class, for example. Is that more effective, or is it more effective to do a HIIT plus strength training, meaning doing a 10 to 15-minute HIIT plus lifting weights? So studies do show that HIIT plus strength training is going to be more effective in these women to reduce abdominal and visceral fat. So that's very important. And another study showed that adding resistance training to HIIT will increase your muscle mass, and the benefits are seen if you have a program that is more than 12 weeks. So for example, if I have a patient that started a program and it's only been 3 to 4 weeks and they get back on our body composition scale and don't see results, well, that's okay, because we need to have a sustained effort. We don't see the results overnight. We don't even see the results after 3 to 4 weeks. We have to have a continuous effort, continuous program, and a program that is progressing with them in order to see results and in order to maintain these results. If I were to ask you, what's the magic recipe? If I were to take you as an example, or what we see in our patients, what's the magic recipe of exercise? What should we do? What can people that are listening do as of tomorrow? What can they change in their workout routine?
So I do think that someone who's, let's say, someone who is fit or who is not fit, I think that having a basis of strength training 3 days a week, 30 to 45 minutes, progressive overloading, and again, not doing random workouts, but really understanding what muscle groups we're working, that's like the basis that we should go off of. Now, I do think that HIIT training, and according to the studies, clearly they do show that HIIT training also has its place. So we would combine HIIT training either throughout those workouts, or we would dedicate maybe another day or two for the HIIT training, because we want to increase your VO2 max. It is a predictor of longevity, and it does help to decrease cardiovascular risk over time, because you can have someone that is very fit, strength training, but their cardiovascular health is not considered fit. So that can also increase the risk of developing diseases over time. So I think that if we incorporate, let's say, a 10 or 15 minutes of HIIT training after a strength training session, let's say you're doing 30 minutes or 45 minutes of strength training, you can add a 10-15 minutes at the end, or you can break that up. What I sometimes recommend to patients is breaking up that 15 minutes into threes. So you can have, let's say, 5 minutes where you do your HIIT training, and you can incorporate that through your sets of, let's say, your strength training. So you can kind of decide what works best for you. If you think that it gasses you up too much for your strength training sessions, then you can kind of put it at the end. But I think that the magic recipe would be 3 days a week strength training and adding a HIIT interval training 10 to 15 minutes at the end or before your exercise sessions.
So if I were to ask you, someone who doesn't have time to dedicate continuous 30 to 45 minutes to working out. So I'm thinking about myself, for example. I have a 16-month-old, and if I don't have 45 minutes, for example, continuously to dedicate to a workout, what should I do? Should I prioritize HIIT versus strength training? Should I still do both? Like, what do you think would be something we would suggest?
I think that if we're able to at least sustain a, let's say, a 20 to 30 minutes of strength training, I think that that's the basis we should go off of. I think that no matter what, strength training should be the basis, because we know that biologically we do lose muscle mass with time. So we have to do whatever it takes to preserve or increase that. Now, the HIIT should be as an add on. So that 10 to 15 minutes, you could either add it on the strength training day, or whenever you can find time in your week, 10 to 15 minutes of just doing HIIT. I think that that's going to be beneficial. But to answer your question, I do think that strength training should be the foundation, and the HIIT should be an add-on for sure.
You know what I would suggest? It goes along the lines that what you're saying, but what I would probably do as a workout, if I just had 20 to 30 minutes, or if I had my baby with me at the gym, for example, at the home gym, I would probably try to incorporate the HIIT. If I don't want to go on a machine, for example, like if I don't want to go on an elliptical or a treadmill, I would probably try to do in between my sets, like you said, either burpees or just fast-paced exercises,
Exactly.
going up and down my box, just to increase my heart rate. So I have a smartwatch, and I would be able to say, okay, for 30 seconds, I'm gonna be able to do this continuous workout, and it doesn't need to be complicated. Just to give you an example, if in my strength training set, in my lifting set, I'm doing lunges, for example, one thing that I would do probably that would increase my heart rate is to let go of my weights and just do jumping squats or jumping lunges and alternating. So just that in itself can increase my heart rate, and then I can pause to reduce my heart rate for a bit and then do that maybe 4 to 5 times just to get my 3 to 4 minutes. So if I don't have 15 minutes to dedicate to my HIIT, at least I would get that ratio of, okay, I have a total of 30 minutes to dedicate on my workout. I will probably have 5, 6 minutes to incorporate HIIT, and the rest will be for my lifting sets, for example. That's what I would do if I had like 30 minutes.
Another add-on actually to that is if, let's say, for example, you don't want to incorporate the HIIT throughout your strength sessions and your time is very limited, what you can also do is you can dedicate the time that you have to the strength training. And studies do show that incorporating exercise snacks, as we call them, throughout your day is going to be more helpful. So, for example, what we suggest is about every 40 to 45 minutes of being seated, you kind of get up and just do a minute or 2 minutes of either bodyweight squats, bodyweight lunges. So that is going to help increase your metabolism over time. It is going to also work your HIIT because you have to make sure that you're doing these exercises at a pretty fast pace to really get your heart rate up. And that is usually what I like to recommend for patients who are, number one, limited on time, but also patients who work from home, that their job is mainly seated jobs. So that can also get your body moving. So if you don't have time to dedicate to the 10 to 15 minutes HIIT, you can either incorporate it throughout your strength training sessions, like she said, or you can really put the time to your strength training and just go for the exercise snacks. So every 40 to 45 minutes of seated time, just kind of get up a minute or two, do your squats, your lunges at a fast pace. So those are options that you can have for sure.
So are we saying to patients that they should stop doing other forms of cardio that are sustained cardio? For example, if you have patients that like to run, that like to go spinning, that like to that like to go to Zumba or dance classes, are we telling them to stop doing that because it's preventing them to get to their goal?
So the answer is no, because at the end of the day, you want exercise or physical activity should be fun. And some people have, a preference for spinning, some people have a preference for yoga, some people have a preference for Pilates, and those are all great forms of exercise. What we are telling them, however, if you're doing, let's say, 3 days a week and you're dedicating 2 days of those for your Pilates and spinning and just 1 day of strength, then you might not see the results that you're looking for. I think that if you want to keep spinning, if you want to keep doing your Zumba, you can keep doing that by all means, but it shouldn't come as a replacement to the strength training. So I would really try to incorporate at least 2 or 3 days of strength, and you can kind of keep that spinning or Pilates or whatever you like to do for the time that you can kind of dedicate to that. But if we want to see results, we have to really put our efforts in the strength training for sure.
So to sum up, what we're saying is movement is important. Whatever form of movement you're getting is great. If we were to compare normal cardio for sustained 45 minutes versus short bits of HIIT workout, HIIT training is more time efficient and can maybe have better results. So if you have to prioritize, let's say one or the other or switch, we're probably suggesting to go more towards a HIIT workout. And the benefit is that you can include it with your strength training days. Like we said, you can incorporate short bouts or do less than, let's say, 15 minutes at the beginning or at the end. But one thing is for sure that strength training is a non-negotiable. Lifting weight is non-negotiable to increase your muscle mass or even to maintain it when you're losing weight, and to increase your basal metabolic rate and to increase your overall longevity and health.
So thank you so much for listening to our podcast, and stay tuned for our next episode. We post episodes every week.